The crystal water glass trembled slightly in my hand as I watched David Chen raise his champagne flute at the head of the conference table. The afternoon Seattle sunlight filtered through the floor-to-ceiling windows of what used to be my corner office, casting long shadows across the mahogany surface where I'd once made decisions that shaped the future of neural interface technology. Now I sat 3 seats down from the head, watching my replacement celebrate his first quarterly success with the same enthusiasm he'd once reserved for his golf swing. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow, I've saved something extra special for you. To innovation and teamwork, David announced, his voice carrying that practiced corporate charisma that had impressed the board 6 months ago. The assembled department heads of quantum dynamics raised their glasses in response, most avoiding eye contact with me. Bradley Martinez, David's longtime golf partner and newly appointed chief technology officer, beamed beside him like a man who'd just discovered he could turn water into wine. If only they knew what was actually flowing through those servers, humming quietly in the basement. I took a measured sip of champagne, maintaining the same composed expression I'd worn since the day David announced my transition from Chief Executive Officer to Senior Research Advisor. The same expression I'd maintained when Bradley, with his bachelor's degree in business administration and zero background in neurotechnology, had been handed control of my life's work. The same expression I'd worn while watching our stock price climb on the momentum of patents they didn't understand, built on research they couldn't replicate. "Sarah," David called out, his tone carrying that particular blend of condescension and false warmth that successful men often used with women they displaced. "We couldn't have achieved this quarter's breakthrough without your foundational research. The Phoenix neural interface patent really opened doors for us." Foundational research. As if the 17 patents I'd developed over the past decade were merely stepping stones for their grand vision. As if the Phoenix neural interface, the crown jewel of brain-computer integration technology, was simply raw material for their improved version. Several colleagues nodded politely while others studied their drinks, probably wondering if I felt bitter about my reduced role in the company I'd built from a cramped laboratory in the University of Washington's basement. "Thank you, David," I replied softly, playing my role perfectly. "I'm glad the research continues to be useful." Bradley shifted in his chair, the only person in the room who seemed genuinely uncomfortable with my presence. Perhaps some part of his conscience recognized that he was occupying a position he'd never earned through merit. Or perhaps he simply didn't want the former CEO watching him fumble through technical discussions he barely comprehended. If he only knew that every line of code running their celebrated system was reporting back to me. Every algorithm they thought they controlled was actually documenting their every modification and mistake. "Sarah's been incredibly gracious about the transition," David continued, addressing the room with the magnanimity of a victor. "Really, it's been the most professional handover I could have hoped for. She didn't even challenge the board's decision about restructuring her equity position." A few department heads nodded approvingly while others maintained diplomatic silence. They probably thought I was either remarkably mature or simply defeated. After all, David's connections with Pacific Venture Capital had brought in $200 million in Series C funding, making him the obvious choice to scale the company. But I hadn't fought the equity restructuring because I didn't need their paper valuations. I had something far more valuable. "Will you be staying in Seattle?" asked Jennifer Walsh, our head of marketing, probably trying to be kind. It must be challenging to step back from day-to-day operations. "I have a small consulting practice now," I answered with the same gentle smile I'd perfected over months of practice. "Nothing too ambitious, but it keeps me engaged with the field." "Any exciting projects?" another executive inquired, the question clearly meant to be polite rather than genuinely interested. "Sarah's more focused on pure research now," David interrupted smoothly. "Less concerned with the commercial applications, more interested in the theoretical foundations. Very admirable work, though not quite aligned with our market-driven approach." More nods of understanding. Sweet Sarah, brilliant but impractical, dedicated to abstract research, while the real business leaders focused on profitable applications. If they could see the server room I'd built in my Bellevue home, where every iteration of their improved Phoenix system was being automatically analyzed, deconstructed, and compared against the original specifications they'd never been given access to. My phone buzzed quietly against my thigh. A message from Marcus Webb, my former chief technology officer and one of the few people who knew what was really happening. Board meeting moved to tomorrow morning. IP audit findings ready for your review. I excused myself to use the restroom, my heels clicking against the polished concrete floors I'd selected when we'd renovated this space 3 years ago. In the privacy of the executive washroom, I checked the audit documents Marcus had prepared. Everything was proceeding exactly as planned. Bradley's team had been making modifications to the Phoenix system for months, each change carefully logged and documented by the monitoring protocols I'd embedded in the original code. What they thought were improvements were actually creating a trail of evidence that would demonstrate their fundamental misunderstanding of the technology they'd inherited. As I returned to the conference room, I heard David entertaining the group with the story of how he'd met Bradley at the Bellevue Country Club. Sometimes networking leads to the most unexpected opportunities, he said, squeezing Bradley's shoulder. When I realized Brad had been thinking about neural interfaces from a business perspective for years, I knew we needed his strategic insight. I remembered another story David used to tell, about a brilliant young researcher whose innovative approach to brain-computer interfaces had caught the attention of venture capitalists. But that was before the board had decided that technical expertise was less valuable than fundraising ability, before my vision for democratizing neural technology had been replaced by their focus on premium medical markets. What David didn't know was that every patent application his team had filed, every technical specification they'd submitted to the FDA, every algorithm they'd claimed as their own improvement was being meticulously compared against my original work. Tomorrow would mark the beginning of the end, not just for David and Bradley, but for the illusion that innovation could be separated from its creator and handed to whoever had the better golf handicap. The celebration continued around me, a carefully orchestrated performance of corporate success built on foundations they didn't understand. With each toast to the company's bright future, with each congratulation on their technical achievements, I felt the weight of tomorrow's revelation growing more satisfying. After all, true innovation, like justice, requires patience and precision, and I had spent 6 months being very, very patient. The morning of the emergency board meeting arrived with typical Pacific Northwest drizzle, the kind of gray Seattle weather that makes glass towers look like monuments to ambition rising from the mist. I arrived at Quantum Dynamics at 6 a.m, using the executive entrance I still had access to as senior research advisor, though I suspected that would change after today's revelations. Marcus waited in what used to be my office, now David's domain of expensive art and golf trophies. Silver-haired and sharp-eyed, he was one of the few people who understood the true scope of what we'd built together over the past decade. He'd been my deputy CTO before David's restructuring had promoted him to a consulting role, another brilliant mind sidelined to make room for Bradley's strategic vision. The documentation is complete, he said, sliding a leather portfolio across the desk where I'd once made decisions that shaped the future of human-computer interaction. Every modification they've made to Phoenix is cataloged and analyzed. The pattern of systematic degradation is undeniable. I opened the portfolio, reviewing months of careful documentation. Bradley's team had been treating the Phoenix neural interface like a software upgrade, rather than a delicate integration of biological and digital systems. Each of their improvements had moved the technology further from its original design principles, creating instabilities they didn't understand and couldn't detect with their limited testing protocols. The FDA submission is particularly interesting, Marcus continued, his tone carrying the dry satisfaction of someone who'd spent his career watching mediocrity fail upward. They've claimed several innovations that are actually degradations of your original architecture. The safety margins alone would make any neurosurgeon reconsider implementation. I smiled, remembering how David had announced Bradley's promotion by praising his, quote, fresh perspective on established technologies.
Preparing and narrating this story took us a lot of time. So if you are enjoying it, subscribe to our channel. It means a lot to us. Now, back to the story.
That fresh perspective was about to reveal itself as a fundamental misunderstanding of the principles that made neural interfaces safe and effective. Is everything ready for the 9 o'clock presentation? I asked, though I already knew Marcus had prepared for this moment with the same meticulous attention to detail that had made our research collaboration so successful. David and Bradley will arrive thinking they're presenting their quarterly achievements to the board, Marcus confirmed. They have no idea that Dr. Elizabeth Hartman from the FDA will be joining us, along with the patent attorneys they requested for their IP expansion discussion. Through the office windows, I could see the early morning Seattle skyline, the Space Needle pointing toward a gray sky that matched my mood perfectly. Somewhere in the city below, David was probably reviewing his presentation slides, preparing to take credit for breakthrough innovations he'd never understood. Bradley was likely practicing technical explanations for concepts he'd learned from Wikipedia articles and YouTube videos. My secure phone buzzed with a message from Amy Chen, my intellectual property attorney, and no relation to David despite the shared surname. Patent Office review complete. Multiple infringement claims ready for filing. Original documentation authenticated and time-stamped. Everything was falling into place with the precision of a well-designed algorithm. For 6 months, I'd maintained my role as the gracious former CEO, attending board meetings as an advisor, offering gentle guidance when asked, never challenging David's authority or questioning Bradley's technical decisions. I'd been the perfect example of professional transition, so accommodating that the board probably felt guilty about how smoothly they'd managed to sideline me. What they didn't know was that I'd been documenting everything. Every email Bradley sent revealing his lack of understanding. Every presentation David gave taking credit for innovations he couldn't explain. Every modification their team made that moved Phoenix further from its safe operational parameters. I'd been building a case not just for patent infringement but for gross negligence in handling technology that interfaced directly with human neural tissue. A soft knock at the door revealed Linda Morrison from Human Resources, carrying a folder that probably contained the termination papers they'd been preparing. Despite everything, I felt a pang of sympathy for Linda, who'd been caught between loyalty to me and orders from the new management structure. "Sarah," she said uncertainly, clearly uncomfortable with her assigned task, "David asked me to discuss your consulting contract renewal. There have been some changes to the terms." I accepted the folder, already knowing what I'd find inside. They were reducing my access to company facilities, limiting my consulting hours, and most importantly, requiring me to sign an expanded non-disclosure agreement that would prevent me from discussing any technical aspects of Phoenix with outside parties. They were trying to isolate me from my own creation. "I understand the company's evolving needs," I replied with the same gentle professionalism I'd maintained throughout this charade. "Let me review these documents and get back to you after today's board meeting." Linda's relief was visible as she left. She probably thought she'd handled an awkward situation gracefully, delivering bad news to someone who'd already accepted her diminished role. If she only knew that in 3 hours, the power dynamics in this building would shift so dramatically that her paperwork would become irrelevant. I spent the next hour reviewing the morning's preparation materials. Dr. Hartman's independent analysis of the modified Phoenix system had identified 17 safety violations and 12 performance degradations introduced by Bradley's team. The patent attorneys had discovered that 4 of the innovations Bradley claimed credit for were actually corrupted versions of my original designs, implementations so flawed they bordered on malpractice. At 8:30, I received confirmation that all the external attendees had arrived. Dr. Hartman was in the main conference room reviewing the technical documentation. The patent attorneys were setting up their presentation materials. And David and Bradley were in the executive lounge, probably congratulating themselves on another successful quarter and planning their next golf outing. Through the building's internal communication system, I could hear the hum of activity as employees arrived for what they thought would be a routine quarterly review. The marketing team was preparing slides about Phoenix's market penetration. The engineering group was ready to present their latest modifications. Everyone was prepared to celebrate continued success built on foundations they didn't understand. At 8:45, my assistant Sarah Kim knocked on the door. Young, brilliant, and one of the few people who'd noticed the discrepancies between Bradley's explanations and the actual system behavior, she'd been quietly documenting inconsistencies for months. "Dr. Chen," she said, using the title David had discouraged since my transition to advisor role. "The board members are asking if you'll be presenting your research update today." "Tell them I have some interesting findings to share," I replied, straightening my blazer. "Nothing too technical, just some observations about the evolution of our core technology. Sarah's expression suggested she suspected something significant was about to happen. As she left to deliver my message, I took one final look at the documentation Marcus and I had assembled. 6 months of careful observation, detailed analysis, and meticulous record-keeping were about to demonstrate the difference between genuine innovation and expensive incompetence. At 8:55, I gathered my materials and headed toward the conference room where David and Bradley would soon discover that replacing a visionary with a golf buddy carried consequences they'd never imagined. The stage was set, the evidence was overwhelming, and the audience included exactly the right combination of regulatory authority and legal expertise to ensure that justice would be both swift and comprehensive. Some lessons about respecting innovation and the people who create it need to be taught with surgical precision and irrefutable documentation. Today, David and Bradley were about to receive an education in the difference between managing technology and understanding it. The main conference room buzzed with anticipatory energy as I entered at exactly 9 o'clock. David sat at the head of the table in what had once been my chair, wearing a confident smile and a tie that probably cost more than some of our engineers made in a week. Bradley occupied the seat to his right, frantically reviewing notes on his tablet, while trying to look like someone who belonged in a room full of PhD researchers and venture capital partners. The board members had arranged themselves around the polished table with practiced corporate choreography. Patricia Williams, our lead investor from Pacific Venture Capital, sat directly across from David, her expression carrying the satisfied look of someone whose portfolio company was exceeding projections. Next to her, Drive. Robert Kim from the University of Washington's Neural Engineering Department maintained his usual academic neutrality, though I caught him glancing curiously at the unfamiliar faces Marcus had arranged to attend. "Good morning, everyone," David began, his voice carrying the authoritative tone he'd perfected since taking over my company. "Before we dive into quarterly results, I'd like to introduce Dr. Elizabeth Hartman from the FDA's Neural Interface Division, who's here to discuss our Phoenix Systems regulatory pathway." Dr. Hartman nodded professionally, her presence lending an air of federal authority to what David assumed would be a celebration of his team's achievements. Patricia Williams looked pleased. FDA engagement usually signaled upcoming approval milestones that drove valuations higher. "We're also joined by the intellectual property team David requested," Marcus added smoothly, gesturing toward the 3 attorneys who'd positioned themselves near the presentation screen. "Amy Chen, Michael Rodriguez, and Jennifer Park from Morrison & Associates, here to discuss patent portfolio expansion." David's smile widened slightly. He'd probably been looking forward to this discussion, imagining how Bradley's innovations would strengthen their IP position and create additional licensing opportunities. The irony was so perfect it felt almost scripted. "Excellent," David said, consulting his agenda. "Sarah, I believe you have a brief research update before we move to the main presentations?" I stood slowly, accepting the wireless presenter remote from Marcus with hands that were steadier than they'd been in months. Every person in the room turned toward me with expressions ranging from polite attention to barely concealed impatience. They were probably expecting a dry academic summary of some peripheral research, the kind of theoretical work that former CEOs occupied themselves with after being gracefully sidelined. "Thank you, David," I began, my voice carrying the same soft professionalism I'd maintained throughout my transition period. "Over the past 6 months, I've been conducting a comprehensive analysis of how the Phoenix neural interface has evolved since the leadership transition. The findings are quite remarkable." The first slide appeared on the main screen, showing a timeline of Phoenix's development from my original research through Bradley's recent modifications. At first glance, it looked like a standard technical presentation, the kind of documentation that made board members glaze over while they waited for revenue projections. "As you can see," I continued, advancing to a more detailed technical schematic, "the current Phoenix implementation differs significantly from the original design architecture. These modifications have been introduced systematically over the past several months." Bradley shifted uncomfortably in his chair, probably recognizing some of the changes his team had made. David maintained his confident expression, though I caught a flicker of uncertainty in his eyes. He'd never bothered to understand the technical details deeply enough to follow complex presentations. Dr. Hartman, I said, turning toward the FDA representative, I believe your independent analysis of the current system reached some interesting conclusions about these modifications. Dr. Hartman opened her own presentation folder, her expression growing more serious as she began to speak. Our review of the Phoenix neural interface as currently implemented identifies several concerning deviations from the original FDA submission. The safety margins that made this technology approvable have been systematically compromised. The room's atmosphere shifted perceptibly. Patricia Williams leaned forward in her chair, her satisfied expression replaced by focused attention. The other board members exchanged glances, clearly unprepared for regulatory concerns during what they'd expected to be a celebration. I'm not sure I understand, David interjected, his practiced confidence beginning to fray around the edges. Our quarterly testing shows continued performance improvements across all metrics. That's precisely the problem, Dr. Hartman replied, advancing to a slide showing comparative brain scan imaging. The performance improvements your team has achieved come at the cost of neural tissue safety. The original Phoenix design included multiple redundant protection systems that have been removed or modified beyond recognition. Bradley's face had gone pale as he stared at the brain scans, showing neural inflammation patterns in tissue exposed to the modified Phoenix system. His tablet remained forgotten in his hands as he struggled to process information that contradicted everything his team had told him about their improvements. These modifications, I continued, taking control of the presentation again, represent a fundamental misunderstanding of how neural interfaces interact with biological systems. Each change your team made in pursuit of performance gains has moved the technology further from safe operational parameters. I advanced to a slide showing code comparisons, highlighting the elegant safety protocols in my original design alongside the crude modifications Bradley's team had implemented. The difference was stark enough that even non-technical board members could see the degradation in system architecture. Furthermore, Amy Chen interjected, standing to address the room, our patent analysis reveals that 4 of the innovations claimed by the current technical team are actually corrupted implementations of Dr. Morrison's original designs. This creates serious intellectual property concerns. David's confident facade finally cracked completely as he realized the direction this meeting was heading. Sarah, I think there might be some misunderstanding about the collaborative nature of this technology development. The Phoenix system has always been a team effort. Actually, Marcus said, producing a thick folder of documentation, we have comprehensive records showing that every core innovation in the Phoenix system originated from Dr. Morrison's individual research. The recent modifications, claimed as improvements, are demonstrably inferior to the original implementations. Patricia Williams had begun furiously taking notes, clearly calculating the potential liability exposure of a company whose core technology had been degraded by incompetent management. The other venture capital representatives were exchanging worried glances, probably wondering how they'd miss the technical risks during their due diligence. This is ridiculous, Bradley protested, finally finding his voice. We've improved system performance by 40%. Our testing shows clear advantages over the original configuration. Your testing methodology is fundamentally flawed, Dr. Hartman replied with clinical precision. The performance gains you've measured come from bypassing safety systems that prevent neural damage. Any neurosurgeon reviewing this data would refuse to implant the modified version. I watched Bradley's face as the full scope of his team's mistakes became clear. He'd been so focused on achieving measurable improvements that he'd never understood why my original design included features he'd seen as inefficient limitations. The safety margins he'd eliminated weren't bugs to be fixed. They were essential protections that kept the interface from causing permanent brain damage. The patent implications are equally serious, Michael Rodriguez added, advancing to his own presentation. Claiming credit for innovations that are actually degraded versions of existing IP creates grounds for fraud charges, not just civil litigation. David had fallen silent, his earlier confidence completely evaporated, as he realized that his golf buddy's technical expertise was not just inadequate, but actively dangerous. The room's energy had shifted from celebration to crisis management, with board members clearly calculating damage control strategies. Dr. Morrison, Patricia Williams said, her voice carrying the sharp edge of someone whose investment was suddenly at risk. "What exactly are you proposing to resolve these issues?" I smiled, advancing to my final slide, which outlined a comprehensive remediation plan. The Phoenix system needs to be immediately reverted to its original design specifications. All patients currently using the modified version need to be contacted for system updates, and the technical leadership needs to be restructured to prevent future safety violations. The silence that followed was deafening. Every person in the room understood the implications. Bradley's modifications hadn't just failed to improve the technology, they'd actively made it dangerous. David's decision to replace technical expertise with golf course networking had nearly caused a regulatory disaster that could have destroyed the company entirely. As I watched their faces process the full scope of the situation, I felt a deep satisfaction that had nothing to do with revenge and everything to do with protecting the technology I'd spent a decade perfecting. Some innovations are too important to be entrusted to people who mistake confidence for competence. The real reckoning was just beginning. The next hour unfolded like a carefully orchestrated dismantling of everything David and Bradley had built on the foundation of my stolen work. Dr. Hartman methodically presented her analysis of each modification, explaining in clinical detail how Bradley's team had systematically removed the safety features that made neural interfaces viable for human use. "This modification here," she said, pointing to a section of code on the main screen, "eliminates the neural feedback monitoring that prevents overstimulation. Without this protection, prolonged use could cause permanent synaptic damage." Bradley stammered through an attempt to defend his team's decisions, but his explanations only revealed how little he understood about the delicate balance between digital systems and neural tissue. Every justification he offered made the situation worse, demonstrating that the modifications hadn't been made from ignorance, but from a dangerous overconfidence in his ability to improve technology he'd never truly comprehended. "We were optimizing for performance," he protested weakly, sweat beading on his forehead despite the conference room's careful climate control. The original parameters seemed overly conservative. Conservative? Dr. Hartman's voice carried the incredulous tone of a medical professional confronting malpractice. "These parameters prevent brain damage. They're not suggestions. They're requirements for safe neural interface operation." Patricia Williams had moved beyond note-taking to active crisis management, her phone buzzing with messages as she coordinated with her firm's legal team. The other board members wore expressions of barely controlled panic as they calculated the potential liability exposure of a company whose core technology had been rendered dangerous by incompetent leadership. "How many patients are currently using the modified system?" Dr. Robert Kim asked, his academic neutrality replaced by genuine concern for patient safety. Marcus consulted his documentation, his expression grim. 17 clinical trial participants and approximately 200 early access patients, all using Phoenix systems modified according to Bradley's specifications. The room fell silent as everyone processed the scope of potential harm. 17 people in clinical trials could be monitored and treated quickly, but 200 patients with implanted neural interfaces represented a medical emergency that could destroy not just the company but everyone associated with it. "Immediate system updates are possible," I said, breaking the silence with the calm authority of someone who actually understood the technology. "The Phoenix architecture includes remote update capabilities. We can revert all active systems to safe parameters within 48 hours. "You can do that remotely?" David asked, his voice carrying a mixture of relief and the dawning realization that I still controlled aspects of technology he'd never understood. The original Phoenix design included comprehensive remote management features, I explained, enjoying the irony that the systems they'd thought they controlled were actually still responding to protocols I'd built. Safety was always the priority, which meant ensuring that dangerous modifications could be reversed quickly. Amy Chen stood to present the intellectual property analysis, her presentation revealing the full scope of patent violations Bradley's team had committed. Each claimed innovation was methodically compared against my original designs, showing how their improvements were actually inferior implementations of existing patents. "The legal implications extend beyond simple IP infringement," she explained, advancing through slides that documented the systematic appropriation of my work. Claiming credit for innovations that demonstrably damage the underlying technology creates potential fraud liability. Jennifer Park added her analysis of the FDA submission process, revealing how Bradley's team had misrepresented their modifications as improvements in their regulatory filings. The agency approval was based on safety data from Dr. Morrison's original design. The modifications implemented after approval constitute unauthorized changes that void the regulatory authorization. David had remained silent throughout these presentations, his face growing paler as the full scope of the disaster became clear. His golf buddy's technical leadership hadn't just failed to improve the company, it had created legal, regulatory, and safety crises that threatened to destroy everything I'd built. "What's our exposure?" Patricia Williams asked bluntly, her investor instincts cutting through the technical complexity to focus on financial liability. "Criminal charges for the technical team," Amy replied with legal precision. "Civil liability for the board that authorized these changes. Regulatory shutdown until safety compliance is restored. And of course, massive damage to company valuation once this becomes public." Bradley had slumped in his chair, his tablet forgotten, as he stared at evidence of his team's catastrophic mistakes. Every modification he'd proudly claimed as an improvement was revealed as a dangerous degradation of carefully designed safety systems. "There has to be something we can do," he said desperately. "Some way to salvage the work we've done." "The work you've done," Dr. Hartman replied with clinical detachment, "consists entirely of making safe technology dangerous. The only salvage option is complete reversion to the original design specifications." I watched David's face as he processed the complete collapse of his leadership strategy. Replacing technical expertise with golf course networking had seemed brilliant when the company's stock price was rising. Now faced with regulatory shutdown and potential criminal charges, his decision to sideline the person who actually understood the technology revealed itself as spectacular mismanagement. "Dr. Morrison," Patricia Williams said, her tone carrying the measured respect of someone whose investment hung in the balance, "we need to discuss immediate remediation steps. What would it take to resolve these safety and regulatory issues?" I had prepared for this moment, developing a comprehensive plan that would restore Phoenix to safe operation while ensuring that future technical decisions would be made by people who actually understood neural interface technology. "Complete technical leadership restructuring," I began, outlining requirements that would effectively restore my control over the technology I'd created. "Immediate reversion to original design specifications, comprehensive patient monitoring and care for anyone affected by the modified systems, and establishment of technical oversight to prevent future safety violations." The implications were clear to everyone in the room. David and Bradley's reign over my company was ending, not through corporate politics or board maneuvering, but through their own spectacular technical incompetence. As I watched them process the destruction of everything they'd thought they'd achieved, I felt the deep satisfaction of someone whose patience had been rewarded with perfect justice. Sometimes the best revenge isn't elaborate schemes or careful manipulation. Sometimes it's simply allowing incompetent people enough rope to hang themselves while you document every mistake they make. The real work of rebuilding was about to begin, but first, David and Bradley needed to fully understand the scope of their failure and its consequences. By 3 o'clock that afternoon, the corporate hierarchy that David had spent 6 months building was collapsing with the efficiency of a controlled demolition. The emergency board session had concluded with Bradley's immediate termination and David's suspension pending investigation, while I found myself reinstated as interim CEO, with full authority to restore Phoenix to safe operational parameters. The irony wasn't lost on me as I sat in my old office, now reclaimed, watching through the floor-to-ceiling windows as Bradley cleared out his desk under the supervision of security personnel. His confident stride had been replaced by the hunched shoulders of someone who'd just discovered that expertise couldn't be faked indefinitely. The expensive technical books he'd purchased to simulate knowledge remained unopened on his bookshelf, testimony to the gap between appearance and understanding. Marcus entered with the latest updates from our patient monitoring initiative. "All 200 early access patients have been contacted," he reported, settling into the chair he'd occupied during our most productive collaboration years. 90% are reporting improved system stability since the overnight updates. The remaining patients are scheduled for in-person evaluation to ensure complete safety compliance. I reviewed the monitoring data on my restored access to Phoenix's diagnostic systems, noting how quickly the technology had responded to proper technical management. 6 months of Bradley's modifications had been reversed in less than 24 hours, restoring the elegant balance between performance and safety that had taken me years to perfect. The clinical trial participants are showing similar improvements, Marcus continued, consulting his tablet. Dr. Patricia Chen at Seattle Medical reports that all 17 patients experienced immediate enhancement in system responsiveness once we reverted to your original algorithms. Through my office windows, I could see David's Porsche still in the executive parking space, though security had confiscated his building access cards and company devices. He was probably sitting in his car making phone calls to lawyers and crisis management firms, trying to salvage a reputation that had been built on claims he could never substantiate. My secure phone buzzed with a message from Amy Chen, updating me on the legal proceedings that were already in motion. Patent infringement documentation filed with USPTO. Criminal complaint submitted to federal prosecutors regarding fraudulent FDA submissions. Bradley Martinez and David Chen named as primary defendants. Everything was proceeding with the systematic precision I'd learned to apply to neural interface development. Every piece of evidence had been carefully preserved. Every violation meticulously documented. Every consequence logically derived from the fundamental mistakes they'd made in trying to improve technology they'd never understood. Sarah Kim knocked softly on my door, her expression carrying the relief of someone who'd watched incompetence masquerade as leadership for too long. Dr. Morrison, the engineering team, is requesting a meeting to discuss restoration protocols. They seem genuinely excited to work with proper technical leadership again. I smiled, remembering how Bradley had regularly dismissed the concerns raised by our most experienced engineers, treating their expertise as obstacles to his vision rather than warnings about dangerous modifications. Schedule a full technical review for tomorrow morning. It's time to rebuild this company's commitment to actual innovation rather than performance theater. The afternoon brought a steady stream of updates as various departments emerged from the fog of David's management style. The marketing team revealed that they'd been struggling to explain Phoenix's benefits, because Bradley's modifications had actually reduced the system's effectiveness while claiming improvement. The Regulatory Affairs Group admitted they'd been concerned about FDA compliance for months, but had been discouraged from raising issues with leadership. Linda Morrison from Human Resources arrived with a different folder this time, containing Bradley's termination paperwork and the official documentation of my reinstatement as CEO. Her earlier discomfort had been replaced by visible relief, as the company's leadership crisis resolved itself through simple accountability. "The board asked me to expedite your executive compensation restoration," she said, placing contracts on my desk that reflected my return to full authority over the company I'd built. "They also wanted me to convey their appreciation for your professional handling of the transition period." Professional handling. As if my 6 months of careful documentation and strategic patience had been simple grace under pressure, rather than a methodical preparation for exactly this outcome. I'd known from the beginning that Bradley's technical incompetence would eventually reveal itself. I'd simply ensured that when it did, the evidence would be comprehensive and irrefutable. My computer chimed with an urgent message from Dr. Elizabeth Hartman at the FDA. Phoenix system restoration confirmed through remote monitoring. Recommend expedited review process for returning to full clinical trial authorization. Preliminary assessment suggests original design architecture meets all current safety standards. The vindication was complete but unsurprising. My original Phoenix design had been built to exceed FDA requirements, precisely because I understood that neural interface technology carried responsibilities that demanded the highest possible safety standards. Bradley's modifications had degraded that safety not through malice but through ignorance, the kind of dangerous overconfidence that mistake complexity for inefficiency. As the day progressed, I received calls from colleagues across the neural interface research community, scientists who'd been quietly concerned about reports of Phoenix's evolution under new management. Dr. Robert Kim from the University of Washington expressed relief that the technology would return to its original research-focused mission, rather than the purely commercial approach David had championed. The financial markets had responded to news of the leadership change with surprising positivity, rather than punishing quantum dynamics for the regulatory crisis. Investors seemed relieved that technical expertise had been restored to leadership. Our stock price had actually increased as word spread that the safety issues were being addressed by the person who'd originally solved them. By evening, the transformation was nearly complete. David's golf trophies had been removed from what was once again my office, replaced by the technical awards and research recognitions that reflected actual achievement rather than networking ability. Bradley's expensive business books had been donated to the building's recycling program, their theoretical knowledge proving worthless without the foundation of genuine understanding. I stood at my office windows as Seattle's skyline emerged from the day's drizzle, city lights beginning to twinkle against the darkening sky. Somewhere out there, David was probably explaining to his wife how his corporate success had evaporated in a single morning. Bradley was likely updating his LinkedIn profile, trying to spin catastrophic technical failure into a learning experience that would somehow advance his career. But those concerns felt distant compared to the satisfaction of having restored Phoenix to its proper trajectory. Tomorrow would bring new challenges as we rebuilt the company's commitment to innovation over performance metrics, but tonight I could appreciate the elegant justice of a system that ultimately rewarded competence over connections. Sometimes the most effective response to being underestimated is simply to wait patiently while maintaining meticulous records. In the end, technology doesn't care about golf handicaps or venture capital connections. It only responds to people who understand it deeply enough to treat it with the respect it demands. The work of genuine innovation was ready to begin again, this time without the interference of people who'd confused corporate politics with technical leadership. And I had plans for Phoenix that would make our previous achievements look like preliminary experiments. The morning sun cast long shadows across my restored office as I reviewed the overnight reports from our patient monitoring systems. Every Phoenix neural interface that had been corrupted by Bradley's modifications was now running on my original algorithms, and the improvement data was remarkable. Neural response times had stabilized, inflammation markers had decreased, and patient comfort scores had jumped by an average of 37%. The technology was healing itself under proper guidance, much like the company would need to do. Marcus entered with coffee and a grim expression, carrying a tablet loaded with legal documents that had arrived throughout the night. David's attorney filed an injunction request, he announced, settling into the chair across from my desk. They're claiming wrongful termination and attempting to freeze the board's decision until they can present alternative evidence. I accepted the coffee, noting how familiar this routine felt after years of collaborative problem-solving. David's legal maneuvering was predictable, the desperate flailing of someone who'd finally realized that confidence couldn't substitute for competence when actual consequences arrived. What's their argument? I asked, though I suspected David's lawyers were grasping at procedural technicalities rather than substantive defenses. Breach of due process, primarily, Marcus replied, scrolling through the injunction filing. They claim the board acted precipitously without giving David adequate opportunity to respond to the technical allegations. They're also suggesting that your analysis was biased by personal animosity rather than objective scientific assessment. The accusation of bias was particularly ironic, given that my 6 months of documentation had been specifically designed to eliminate any appearance of personal motivation. Every piece of evidence we'd presented had been independently verified, every conclusion supported by data that any competent neural interface researcher could replicate. Dr. Hartman's FDA analysis should neutralize the bias claims, I observed, reviewing the federal regulatory report that had been filed overnight. It's difficult to argue personal animosity when an independent government scientist reaches identical conclusions about safety violations. My secure phone buzzed with a priority message from Amy Chen, our intellectual property attorney. Emergency hearing scheduled for this afternoon. David's team is claiming the patent violations were inadvertent and requesting opportunity for remediation rather than criminal prosecution. Inadvertent patent violations. As if systematically claiming credit for innovations they'd corrupted through ignorance could be dismissed as an honest mistake. The documentation Marcus and I had assembled told a different story, revealing a pattern of deliberate misrepresentation that went far beyond simple technical errors. Sarah Kim appeared at my door with an unusual expression, carrying a visitor badge and looking somewhat bewildered. "Dr. Morrison, there's someone here to see you." Victoria Lang from TechCrunch. She says she's working on a story about neural interface safety and corporate governance. I paused, recognizing the name from several investigative pieces that had exposed technical incompetence in Silicon Valley startups. Victoria Lang had built her reputation by understanding complex technologies well enough to identify when executives were making dangerous decisions based on inadequate knowledge. Send her up, I decided. And ask Marcus to join us with the public documentation files. 20 minutes later, Victoria Lang entered my office with the focused energy of an investigative journalist who'd discovered a story with broader implications than simple corporate drama. She was younger than I'd expected, probably in her early 30s, with sharp eyes and a recording device that she placed on my desk with practiced efficiency. "Dr. Morrison," she began, consulting notes that suggested she'd already done considerable research. "I've been tracking reports of neural interface complications over the past few months. Several patients have contacted me about Phoenix system irregularities that seem to correlate with changes in your company's technical leadership." Marcus arrived with carefully prepared documentation, the kind of public records that could be shared without violating patient privacy or corporate confidentiality. Victoria's questions revealed that she understood neural interface technology well enough to recognize the significance of Bradley's modifications. "These algorithm changes," she said, studying the technical comparisons we'd provided, "they're not incremental improvements. They represent fundamental alterations to how the system interacts with neural tissue." What was the technical justification for such dramatic modifications? There wasn't one, I replied simply. The modifications were implemented without proper understanding of their biological implications. Performance metrics improved while safety margins degraded, which suggests optimization for the wrong variables. Victoria's expression sharpened as she processed the implications. "Are you saying that patients were exposed to increased risk so that the company could report better quarterly numbers?" "I'm saying that technical decisions were made by people who prioritized measurable improvements over fundamental safety principles," I clarified, choosing my words carefully. The consequences were predictable to anyone with sufficient expertise in neural interface design. The interview continued for over an hour as Victoria methodically documented the timeline of Bradley's modifications and their effects on patient safety. Her questions revealed that she'd already spoken with several Phoenix users who'd noticed changes in their system behavior, though none had initially connected their experiences to corporate leadership changes. The FDA report suggests that some of these modifications could have caused permanent neural damage, Victoria noted, consulting Dr. Hartman's analysis. Were patients informed about the risks associated with these system updates? Marcus and I exchanged glances, both recognizing the regulatory violation that Victoria had identified. Patients had received routine software updates without being told that fundamental safety parameters were being altered, a clear violation of informed consent protocols that should have triggered immediate FDA notification. The modification process bypassed standard clinical trial procedures, Marcus confirmed, providing documentation that showed how Bradley's team had classified dangerous algorithm changes as routine maintenance updates. Patients were never informed that experimental modifications were being implemented in their neural interfaces. Victoria's recording device captured every detail as we outlined the scope of regulatory violations, patent infringement, and safety compromises that had resulted from David's decision to replace technical expertise with golf course networking. Her questions grew more pointed as she recognized the broader implications for the neural interface industry. "This isn't just about one company's management decisions," she observed, reviewing the timeline of events. "If venture capital firms are prioritizing fundraising ability over technical competence, other neural interface companies could be making similar mistakes." The insight was precisely why I'd agreed to the interview. The Phoenix situation wasn't an isolated incident, but rather a symptom of how Silicon Valley's emphasis on growth metrics could compromise technologies that required deep technical understanding to implement safely. Neural interfaces represent a unique category of medical device, I explained, conscious that Victoria's article would reach decision makers throughout the technology industry. The interface between digital systems and biological neural networks requires expertise that can't be acquired through business school training or networking relationships. As Victoria prepared to leave, she paused at my office door with one final question that suggested she understood the personal dimension of the story she was investigating. Dr. Morrison, you spent 6 months documenting these safety violations while maintaining your advisory role. Why didn't you speak out sooner about the risks to patient safety? I considered the question carefully, recognizing its importance for her readers who might face similar situations in their own careers. I needed irrefutable documentation that demonstrated the pattern of dangerous decision-making. Speaking out prematurely would have been dismissed as personal grievance rather than legitimate safety concern. Victoria nodded, understanding the strategic patience that had been required to build a case strong enough to overcome corporate politics and legal challenges. Her article would frame the Phoenix situation as a cautionary tale about the importance of maintaining technical leadership in companies developing life-critical technologies. After Victoria left, Marcus and I reviewed the afternoon's preparation materials for David's injunction hearing. His legal team would argue procedural violations and request additional time to respond to the technical allegations, but they would struggle to address the fundamental safety issues that had triggered the emergency board action. Their best strategy will be attacking the timeline, Marcus observed, reviewing David's legal brief, claiming that 6 months of documentation suggests premeditation rather than objective analysis. Let them make that argument, I replied, confident that the evidence would speak for itself. Premeditation implies planning to create problems, rather than planning to document problems that already existed. My computer chimed with an update from our patient monitoring team. Every Phoenix user had now been contacted about the system restoration, and the medical data was consistently positive. Neural interface stability had improved across all measured parameters, providing objective evidence that my original design was superior to Bradley's modifications. The afternoon hearing would determine whether David could delay the consequences of his technical leadership failures, but the evidence was too comprehensive, and the safety issues too serious for legal maneuvering to provide meaningful protection. Sometimes justice arrives not through dramatic confrontation, but through the patient accumulation of irrefutable facts. As I prepared for the courtroom phase of this corporate restoration, I reflected on the broader lessons that Victoria Lang's article would communicate to the technology industry. Innovation requires more than venture capital and business acumen. It demands deep technical understanding and unwavering commitment to safety over superficial performance metrics. The Phoenix neural interface had survived Bradley's modifications and would emerge stronger under restored technical leadership. But the real victory wasn't corporate or personal. It was the demonstration that expertise matters, that shortcuts in complex technologies carry real consequences, and that patient safety must always take precedence over quarterly projections. The King County Courthouse buzzed with afternoon energy, as lawyers and journalists gathered for what many expected to be a routine corporate injunction hearing. I sat beside Amy Chen in the plaintiffs' section, watching David's legal team arrange their materials with the confident efficiency of attorneys who specialized in using procedural complexity to obscure substantive failures. Judge Patricia Chen, no relation to my attorney despite the shared surname, had built her reputation on cutting through corporate legal theater to focus on factual evidence. Her preliminary review of the case materials suggested she understood that this hearing would determine whether technical incompetence could be protected by legal technicalities. Your Honor, began David's lead attorney, a silver-haired partner from Morrison & Associates who specialized in executive protection cases. My client was terminated without due process based on allegations that were developed in secret over 6 months. This suggests premeditated corporate sabotage rather than legitimate safety concerns. The argument was predictable but fundamentally flawed, treating my documentation of Bradley's mistakes as evidence of malicious intent rather than responsible oversight. David sat behind his legal team, wearing his most expensive suit, probably hoping that professional appearance would compensate for professional incompetence. Mr. Thompson, Judge Chen addressed David's attorney with the patient tone of someone accustomed to corporate misdirection. Are you disputing the technical findings presented by the FDA and independent patent experts? Or are you arguing that your client should have been given additional time to respond to those findings? Both, Your Honor, Thompson replied, consulting notes that probably contained more legal precedent than technical understanding. The allegations are disputed, and the termination process violated established corporate governance procedures. Amy Chen rose to respond, her presentation organized around the comprehensive documentation that made David's procedural arguments irrelevant. Your Honor, when patient safety is compromised by technical incompetence, corporate governance procedures become secondary to immediate remediation requirements. She advanced to a slide showing the brain imaging data that Dr. Hartman had presented, neural tissue inflammation patterns that demonstrated the biological consequences of Bradley's modifications. The visual evidence was more compelling than any legal argument, showing real harm to real patients caused by decisions that prioritized performance metrics over safety margins. The FDA analysis confirms that patients were exposed to increased neural damage risk without informed consent, Amy continued, presenting documentation that revealed the scope of regulatory violations. This isn't a personnel dispute, it's a medical emergency that required immediate technical leadership restoration. Judge Chen reviewed the medical evidence with obvious concern, her expression growing more serious as she processed the implications of neural interface modifications that had compromised patient safety. The legal complexity that David's team was invoking seemed increasingly irrelevant compared to evidence of actual harm. Mr. Thompson, the judge said, returning her attention to David's attorney, does your client dispute that the technical modifications resulted in increased patient risk? Thompson consulted with David briefly before responding, their whispered conversation revealing the fundamental weakness in their position. They couldn't dispute the technical evidence without demonstrating knowledge they clearly didn't possess. Your Honor, my client maintains that the system modifications were implemented following standard industry practices and resulted in measurable performance improvements. Any negative consequences were unintended and could have been addressed through proper consultation rather than immediate termination. The response revealed how completely David still misunderstood the situation. Standard industry practices for neural interface development required extensive safety testing before implementing modifications that affected biological interactions. Performance improvements that compromised patient safety weren't achievements to be defended but failures to be corrected immediately. Dr. Elizabeth Hartman had been called as an expert witness, her federal credentials lending authority to testimony that methodically dismantled any suggestion that Bradley's modifications had followed proper procedures. Her presentation was clinical and devastating, explaining in precise detail how each algorithm change had moved the Phoenix system further from safe operational parameters. Neural interface modifications require comprehensive biological testing, Dr. Hartman explained, addressing the judge with the clarity of someone accustomed to explaining complex science to non-technical audiences. The defendants implemented changes that fundamentally altered how the system interacted with neural tissue, without conducting any safety assessments. Judge Chen's questions revealed that she grasped the significance of the medical evidence despite its technical complexity. Dr. Hartman, in your professional opinion, could these modifications have caused permanent neural damage? Absolutely, Your Honor. Prolonged exposure to the modified algorithms could have resulted in irreversible synaptic degradation and chronic neuroinflammation. The original design included multiple protection systems specifically to prevent these outcomes. The courtroom atmosphere shifted as the judge processed testimony that transformed David's injunction request from a corporate governance dispute into a public safety issue. Legal procedures seemed increasingly inadequate for addressing situations where executive incompetence created medical emergencies. Marcus was called to testify about the technical documentation process, his presentation demonstrating how my 6 months of evidence gathering had been motivated by scientific rigor rather than personal revenge. Every modification had been analyzed against established neural interface safety standards, creating an objective record of progressive system degradation. Dr. Morrison's documentation followed standard peer review protocols, Marcus explained, presenting methodology that any scientist would recognize as proper research practice. Each algorithm change was evaluated for biological safety implications, and the cumulative evidence revealed a clear pattern of degraded patient protection. David's legal team attempted to characterize my documentation as corporate espionage, but their arguments collapsed under the weight of evidence that I'd been monitoring my own technology through legitimate oversight channels. The Phoenix neural interface remained my intellectual property, making system monitoring a responsibility rather than a violation. Mr. Thompson, Judge Chen said, her patience clearly wearing thin, your client was terminated for technical incompetence that compromised patient safety. Are you arguing that corporate executives have a right to endanger patients without consequence? The question cut to the heart of David's legal strategy, exposing how his procedural arguments were designed to protect executive privilege rather than address legitimate safety concerns. Thompson's response was evasive, acknowledging the seriousness of patient safety while continuing to argue for David's reinstatement. Your Honor, my client disputes the characterization of his leadership as incompetent and requests opportunity to present alternative technical analysis that supports the modifications in question. Alternative technical analysis from whom? The judge inquired, her tone suggesting she already suspected the answer. Thompson's hesitation revealed that David's team had no qualified neural interface experts willing to defend Bradley's modifications. Any competent scientist reviewing the evidence would reach the same conclusions as Dr. Hartman and myself, making expert witness support impossible to obtain. Amy Chen's closing argument was precisely calibrated, emphasizing patient safety over corporate politics, while demonstrating that David's termination had been both necessary and legally justified. Her presentation concluded with updated medical data showing improved patient outcomes since the system restoration, objective proof that my technical leadership had been essential for protecting neural interface users. Your Honor, Amy said, consulting the latest monitoring reports. Every Phoenix patient has experienced improved system stability since Dr. Morrison's reinstatement as CEO. This demonstrates that the technical allegations were accurate and that immediate leadership change was medically necessary. Judge Chen retired to chambers for 45 minutes, leaving David and his legal team to contemplate evidence that had systematically demolished their arguments. When she returned, her decision was delivered with the clinical precision of someone who'd recognized that legal complexity couldn't obscure medical necessity. Mr. David Chen's injunction request is denied, she announced, her voice carrying the authority of judicial determination. The evidence demonstrates that patient safety required immediate technical leadership restoration. Corporate governance procedures, while important, cannot supersede medical emergency protocols. David's face went pale as he processed the complete failure of his legal strategy. His attorneys began discussing appeal options, but their whispered conversations revealed that they understood the futility of challenging medical evidence with procedural arguments. As we left the courthouse, Amy Chen updated me on the broader legal proceedings that would continue for months. The criminal patent fraud case proceeds to grand jury next week. The FDA is opening a formal investigation into the modification approval process, and Victoria Lang's article publishes tomorrow morning. The legal victory was satisfying but secondary to the restoration of Phoenix to safe operation and my return to technical leadership of the company I'd built. David's injunction failure had been predictable once the medical evidence was properly presented, but it marked the definitive end of his attempt to separate innovation from understanding. Walking back to quantum dynamics through downtown Seattle, I reflected on how the day's proceedings had demonstrated the ultimate primacy of expertise over politics in technologies that directly affected human health. Neural interfaces couldn't be managed like software companies or retail chains. They required leaders who understood the delicate balance between digital innovation and biological safety. David and Bradley had learned that lesson too late, but their failure would serve as a cautionary tale for other executives who might be tempted to treat complex medical technologies as conventional business opportunities. Sometimes the most important innovations are the ones that prioritize patient safety over performance metrics, even when those priorities conflict with quarterly expectations. The real work of rebuilding quantum dynamics could now begin in earnest, free from the interference of leaders who'd confused corporate networking with technical competence. And I had plans for Phoenix that would establish new standards for neural interface safety while advancing the field beyond anything Bradley's modifications could have achieved. The week following David's failed injunction brought a cascade of developments that transformed quantum dynamics from a company in crisis to an industry leader in neural interface safety protocols. Victoria Lang's TechCrunch article had been published with devastating precision, documenting the complete timeline of how venture capital priorities had nearly destroyed breakthrough medical technology through executive incompetence. I stood in my office reading the article's opening paragraph aloud to Marcus, savoring the clarity with which Victoria had captured the essential lessons of our situation. When venture capital firm Pacific Venture Capital replaced neural interface pioneer Drive, Sarah Morrison, with fundraising specialist David Chen, they prioritized business development over technical expertise. The result was a series of dangerous modifications to life-critical medical technology that could have caused permanent brain damage to hundreds of patients. The article had been shared thousands of times across social media, sparking industry-wide discussions about the importance of technical leadership in companies developing medical devices. Neural interface researchers from universities and companies worldwide had reached out to express support for our patient safety initiatives and to share their own concerns about business-driven technical decisions. The response from the research community has been remarkable, Marcus observed, reviewing emails from colleagues who'd been quietly worried about similar issues at their own institutions. Dr. Elizabeth Chen at Stanford wants to collaborate on safety protocol development. The European Neural Interface Consortium is requesting consultation on their regulatory framework revision. I smiled, recognizing that Phoenix's crisis had created an opportunity to establish industry-wide standards that would prevent other companies from making Bradley's mistakes. Technical expertise was being recognized as essential rather than optional for neural interface development, a shift that would protect both patients and innovation. My secure phone buzzed with an update from Amy Chen about the criminal proceedings that were advancing with remarkable speed. Grand jury issued indictments this morning. David Chen and Bradley Martinez charged with patent fraud, regulatory violation, and reckless endangerment. Pacific Venture Capital facing civil penalties for inadequate due diligence. The criminal charges represented more than personal justice. They established legal precedent that executives could be held criminally responsible for technical decisions they made without adequate expertise. Future venture capital firms would need to consider whether their portfolio company leadership possessed the knowledge necessary to manage complex technologies safely. Sarah Kim entered with the morning's media requests. A stack of interview invitations from business publications, medical journals, and technology podcasts. Dr. Morrison, the Harvard Business Review, wants to discuss corporate governance in medical technology companies. The New England Journal of Medicine is requesting an article about neural interface safety protocols. Each interview request represented an opportunity to educate business leaders about the importance of maintaining technical expertise in companies developing life-critical technologies. The Phoenix crisis had become a case study that would be taught in business schools and medical ethics courses, demonstrating the real-world consequences of prioritizing growth metrics over safety margins. Linda Morrison from Human Resources arrived with restoration documents that officially reinstated my full executive authority and equity position. The board asked me to express their appreciation for your professional handling of the transition period, she said, though we both understood that my professional handling had actually been strategic preparation for this exact outcome. The morning brought news that Pacific Venture Capital had quietly begun restructuring their investment approach, adding technical advisory requirements to their due diligence process for medical device companies. Patricia Williams had been reassigned to consumer technology investments, while the firm recruited neural interface researchers to evaluate future portfolio opportunities. Dr. Robert Kim called from the University of Washington with an unexpected proposal. Sarah, the National Science Foundation wants to fund a collaborative research initiative on neural interface safety standards. They're offering $5 million over 3 years, with Quantum Dynamics as the lead institution. The NSF funding would allow us to develop comprehensive safety protocols that could be adopted industry-wide, preventing other companies from implementing dangerous modifications like Bradley's. More importantly, it would establish our research as the foundation for federal regulatory standards that would protect patients regardless of corporate leadership changes. Marcus entered with the latest patient monitoring reports, data that continued to demonstrate the superiority of my original Phoenix design over Bradley's modifications. Neural response stability has improved by an average of 42% across all patients. Inflammation markers are now below pre-modification baseline levels. The tissue healing data is remarkable. I reviewed the medical evidence that would become part of our NSF research proposal, objective proof that patient-focused design principles produced better outcomes than performance-optimized modifications. The Phoenix system was healing itself under proper technical guidance, much like the company was recovering under restored leadership. Victoria Lang called to follow up on reader response to her article, which had generated more engagement than any previous TechCrunch piece about medical technology. Dr. Morrison, I'm receiving interview requests from patients who want to share their experiences with Phoenix system improvements. Would you be willing to participate in a follow-up article about the recovery process? The patient perspective would add human dimension to the technical documentation that had driven David and Bradley's downfall. Their stories would demonstrate that corporate governance wasn't abstract business theory, but had real consequences for people whose lives depended on properly designed medical technology. I'd be honored to participate, I replied, recognizing the opportunity to give Phoenix users a voice in discussions about their own medical care. Patient experience should be central to any evaluation of neural interface technology. Amy Chen arrived for our afternoon legal strategy session, bringing updates on the broader implications of the criminal case against David and Bradley. The FDA is using our documentation as the foundation for revised neural interface approval protocols. Future system modifications will require independent safety review before implementation. The regulatory changes would prevent other companies from bypassing safety assessments through software update classifications, ensuring that patients received proper informed consent before experimental modifications were implemented in their neural interfaces. Phoenix's crisis was generating protections that would benefit the entire neural interface community. As afternoon sunlight streamed through my office windows, I reflected on how completely the situation had transformed since David's celebratory dinner just weeks earlier. His confident toasts to innovation and teamwork had been replaced by criminal indictments and professional disgrace, while Bradley's strategic vision had been revealed as dangerous incompetence that could have caused irreversible neural damage. The business press had begun referring to the situation as the Phoenix reversal, a case study in how patient safety requirements could override venture capital priorities when properly documented and presented. Business schools were already developing curriculum around the importance of technical expertise in medical device leadership. My computer chimed with a priority message from Dr. Elizabeth Hartman at the FDA, updating me on the agency's broader investigation into neural interface companies. Preliminary review identifies similar safety concerns at 3 other firms. Can we arrange consultation on proper modification protocols? The Phoenix situation was revealing industry-wide problems that had been hidden by business-focused leadership teams who lacked the technical knowledge to recognize dangerous practices. Our crisis was becoming a catalyst for comprehensive reform that would protect patients across the entire neural interface sector. Marcus knocked on my door with news that would complete the day's transformation narrative. Dr. Morrison, Bradley Martinez's LinkedIn profile has been updated. He is now listed as seeking opportunities in business development rather than technical leadership. I smiled at the symbolic recognition that Bradley had finally acknowledged his limitations, though the criminal charges would likely limit his future opportunities in either business or technology. His failure had demonstrated that neural interface development required more than confidence and networking. It demanded deep technical understanding that couldn't be acquired through management training or golf course connections. The real work of advancing neural interface technology was ready to begin again, this time with proper technical leadership and comprehensive safety protocols that would protect both innovation and patients. Phoenix had survived its brush with corporate incompetence and would emerge as the foundation for industry standards that prioritized medical ethics over quarterly projections. As Seattle's skyline began to glow with evening lights, I prepared for tomorrow's meetings with research collaborators who would help establish neural interface safety protocols, as rigorous as the technology itself. The Phoenix reversal was ending not with revenge, but with restoration, demonstrating that expertise ultimately mattered more than executive politics and technologies that touched human lives. The following morning brought news that would permanently transform the neural interface industry's approach to technical leadership and patient safety. I arrived at Quantum Dynamics to find Marcus waiting with a tablet displaying headline coverage from major business publications. all focusing on the broader implications of what journalists were now calling the Phoenix paradigm shift. The Wall Street Journal is running a front-page analysis of technical expertise requirements in medical device companies, Marcus reported, settling into his familiar chair across from my desk. They're using our situation as the primary case study for a series on corporate governance in life sciences. I scanned the article, noting how completely the narrative had shifted from David's initial portrayal as a visionary leader to a cautionary tale about the dangers of replacing subject matter expertise with general business acumen. The business community was beginning to understand that medical device companies couldn't be managed like software startups or retail chains. The Harvard Business Review called, Sarah Kim announced, entering with the day's media schedule. They want to feature you in their next issue on authentic leadership in complex technology sectors. The interview is scheduled for this afternoon. Each media appearance represented an opportunity to establish new standards for how venture capital firms evaluated medical device leadership, ensuring that future investment decisions would prioritize technical competence over fundraising ability. The Phoenix crisis was becoming a watershed moment that would protect both innovation and patient safety. Dr. Elizabeth Hartman called with updates on the FDA's expanded investigation into neural interface companies, her tone carrying the satisfaction of a regulator who discovered systemic problems that could be addressed through comprehensive reform. We've identified safety violations at 4 additional companies, she reported, consulting preliminary findings that suggested David and Bradley's mistakes weren't isolated incidents. All involved business leaders making technical decisions without adequate expertise. Your documentation methodology is becoming our standard protocol for evaluating industry practices. The revelation that Phoenix's problems represented broader industry patterns was both concerning and encouraging. Concerning because it suggested that venture capital priorities had compromised patient safety across multiple companies, but encouraging because it validated our approach and created momentum for industry-wide reform. Amy Chen arrived with legal updates that demonstrated how quickly criminal proceedings were advancing now that the technical evidence had been properly presented. David and Bradley's plea negotiations begin next week, she announced, consulting federal prosecutor communications. Their attorneys are requesting reduced charges in exchange for cooperation with the broader industry investigation. The prospect of David and Bradley providing evidence about other companies' technical leadership failures would accelerate the FDA's reform initiatives while establishing legal precedent that executives could be held criminally responsible for endangering patients through incompetent decision-making. Marcus entered with patient monitoring reports that continued to show remarkable improvement since Phoenix systems had been restored to my original specifications. Neural interface stability has plateaued at optimal levels, he reported, reviewing data that demonstrated the superiority of patient-focused design principles. Dr. Patricia Chen at Seattle Medical wants to expand the clinical trial program based on these outcomes. The medical evidence was providing objective validation that technical expertise produced better patient results than business-optimized modifications, supporting our argument that neural interface companies required leaders who understood the biological implications of their decisions. Victoria Lang called to discuss her follow-up article, which would feature interviews with Phoenix patients who'd experienced the transition from Bradley's modifications back to my original design. Dr. Morrison, the patients' stories are remarkable, she said, her excitement evident even through the phone connection. They're describing improvements they didn't even realize were possible. The patient perspective would add emotional weight to the technical documentation that had driven corporate reform, demonstrating that business governance decisions had real human consequences that extended far beyond quarterly financial reports. One patient told me that her Phoenix system feels like it's working with her brain rather than fighting against it. Victoria continued, reading from interview notes that captured the fundamental difference between my biological-focused design and Bradley's performance-optimized modifications. She said the difference is like switching from a car with square wheels to one designed for actual driving. The analogy was perfect, illustrating how Bradley's modifications had optimized for measurable metrics, while degrading the essential compatibility between digital systems and neural tissue. Technical innovation required understanding the complete system, not just individual performance variables. Linda Morrison brought news that the board had unanimously approved my proposal for comprehensive technical leadership restructuring, including requirements that all future executives in technical roles possess relevant expertise rather than general business credentials. The new hiring protocols require peer review by recognized experts in the relevant field, she explained, presenting documentation that would prevent future Bradley Martinez situations. Business development roles remain separate from technical decision-making authority. The governance changes would protect quantum dynamics from future technical leadership failures, while establishing a model that other companies could adopt. The Phoenix crisis was generating systematic reforms that would benefit the entire neural interface industry. Dr. Robert Kim called with news about the National Science Foundation collaboration, which had expanded beyond our original proposal to include research partnerships with institutions across the United States and Europe. The NSF wants to establish quantum dynamics as the coordinating center for international neural interface safety standards, he announced, describing a role that would position our company as the global leader in patient-focused technology development. The funding commitment has increased to $12 million over 5 years. The federal recognition represented validation that our approach to neural interface development was being adopted as the international standard, ensuring that future innovations would prioritize patient safety over corporate performance metrics. Marcus entered with afternoon updates, showing how completely the corporate landscape was shifting in response to the Phoenix paradigm shift. 3 venture capital firms have announced new technical advisory requirements for medical device investments, he reported, consulting industry publications that were documenting widespread changes in investment practices. Pacific Venture Capital's restructuring is being copied across the sector. The transformation was happening faster than I'd anticipated, driven by recognition that technical expertise couldn't be separated from business success in companies developing life-critical technologies. The venture capital community was learning that patient safety and financial performance were aligned, rather than competing objectives. My computer chimed with a message from the European Neural Interface Consortium, requesting consultation on regulatory framework development that would incorporate lessons learned from the Phoenix situation. The crisis was becoming the foundation for international standards that would protect patients, regardless of corporate leadership decisions. As afternoon sunlight streamed through my office windows, I reviewed the comprehensive transformation that had emerged from 6 months of careful documentation and strategic patience. David's replacement of technical expertise with golf course networking had nearly destroyed breakthrough medical technology, but the resulting crisis had generated reforms that would protect the entire neural interface industry. The Phoenix reversal was complete, demonstrating that innovation required more than venture capital and business acumen. Real breakthrough technology demanded leaders who understood the fundamental principles underlying their products, particularly when those products interface directly with human biology. Tomorrow would bring new challenges as we work to establish international safety standards and expand Phoenix's capabilities under proper technical guidance. But tonight, I could appreciate the elegant justice of a system that ultimately rewarded competence over connections, expertise over networking, and patient safety over quarterly projections. Sometimes the most effective response to being underestimated is simply maintaining meticulous records, while allowing incompetent people to demonstrate their limitations through their own decisions. The Phoenix neural interface had survived its encounter with corporate politics and emerged as the foundation for industry standards that would protect innovation and patients for generations to come. The real work of advancing human-computer interface technology was ready to begin again, this time with leadership that understood the profound responsibility that came with touching human consciousness itself. 3 months after the criminal indictments were handed down, I stood before the International Neural Interface Safety Summit in Geneva, addressing an audience of researchers, regulators, and industry leaders who had gathered to establish global standards for medical device governance. The Phoenix crisis had become the catalyst for comprehensive reform that extended far beyond corporate accountability to encompass fundamental questions about innovation responsibility in life-critical technologies. The auditorium was filled with faces I recognized from academic conferences and industry meetings, scientists who had been quietly concerned about the trajectory of neural interface development under business-focused leadership. Dr. Elizabeth Hartman sat in the front row beside regulatory officials from 12 countries, all working to develop international protocols that would prevent future safety compromises. Ladies and gentlemen, I began, looking out at an audience that represented the global neural interface community. The Phoenix situation demonstrates that technical innovation cannot be separated from technical understanding without endangering the very people our technologies are designed to help. My presentation outlined the systematic safety violations that had resulted from David and Bradley's modifications, using their failures as educational examples rather than personal grievances. Each slide demonstrated specific principles of neural interface design that required deep biological understanding, knowledge that couldn't be acquired through business training or management experience. Neural interfaces represent a unique category of medical technology, I continued, advancing to brain imaging data that showed the healing process in patients whose systems had been restored to proper specifications. The interface between digital algorithms and neural tissue requires leaders who understand both computational efficiency and biological compatibility. The audience listened with rapt attention as I detailed the recovery process that had restored Phoenix to optimal function while establishing new industry standards for safety assessment. Several participants took notes as I described the monitoring protocols that had documented Bradley's systematic degradation of patient protection systems. Dr. Yuki Tanaka from Tokyo University raised her hand during the question period, her inquiry reflecting concerns that had emerged across the global research community. Dr. Morrison, how do we ensure that venture capital firms understand the importance of technical expertise when evaluating medical device companies? The question captured the central challenge facing the neural interface industry as investment capital increasingly came from firms focused on growth metrics rather than innovation quality. My response drew on lessons learned from Pacific Venture Capital's restructuring and the broader changes occurring throughout the investment community. Investment firms are beginning to recognize that technical competence and business success are aligned objectives in medical device development, I replied, citing examples of venture capital firms that had hired neural interface researchers as technical advisors. The Phoenix situation demonstrated that prioritizing business development over technical expertise creates liability exposure that threatens both patient safety and financial returns. The conference continued for 3 days as participants developed comprehensive protocols for neural interface safety assessment, regulatory oversight, and corporate governance. Our work would become the foundation for international standards that protected both innovation and patients, ensuring that future technical decisions would be made by people who understood their biological implications. Marcus had remained in Seattle to oversee Phoenix's continued development under our restored technical leadership structure, but he joined the conference virtually to present data on patient outcomes that validated our safety-focused approach. His presentation showed remarkable improvement in neural interface stability, patient satisfaction, and biological compatibility since the system had been restored to proper specifications. The medical evidence is unambiguous, Marcus reported to the global audience, displaying charts that demonstrated the superiority of patient-focused design principles. Every measured parameter improved when Phoenix returned to its original architecture. The performance optimizations that Bradley's team implemented actually degraded the fundamental compatibility between digital systems and neural tissue. Dr. Elizabeth Hartman presented the FDA's expanded investigation findings, revealing that Phoenix's problems had indeed represented broader industry patterns that required systematic correction. Her data showed safety violations at 7 companies where business leaders had made technical decisions without adequate expertise, creating risks that extended across the entire neural interface sector. The Phoenix documentation methodology has become our standard protocol for evaluating industry practices, Dr. Hartman announced, describing how our 6 months of evidence gathering had established new regulatory assessment procedures. Technical leadership requirements are now part of FDA approval criteria for neural interface companies. The regulatory changes represented more than administrative adjustments. They established legal requirements that executives possess relevant expertise before making decisions that affected patient safety. Future David Chen's and Bradley Martinez's would be prohibited from endangering patients through incompetent modifications to life-critical technologies. Victoria Lang joined the conference as a media representative, documenting the international response to what had become known as, quote, the Phoenix Protocols. Her follow-up articles had tracked the widespread adoption of technical leadership requirements across the venture capital industry, demonstrating how quickly business practices could change when patient safety concerns were properly presented. The neural interface community has embraced comprehensive reform with remarkable speed, Victoria observed during a panel discussion on media coverage of medical device governance. The Phoenix situation provided clear evidence that technical expertise and business success were compatible objectives, rather than competing priorities. Amy Chen participated virtually to discuss the legal precedents established by David and Bradley's criminal convictions, which had been finalized through plea agreements that included cooperation with ongoing industry investigations. Their cases had established that executives could be held criminally responsible for endangering patients through technical decisions made without adequate knowledge. The legal framework now recognizes technical competence as a mandatory qualification for medical device leadership, Amy explained to an audience of regulatory officials and industry attorneys. Business development experience alone is insufficient qualification for positions that involve patient safety decisions. The criminal precedents were being applied to other cases as federal prosecutors investigated additional companies where business leaders had endangered patients through incompetent technical modifications. The Phoenix situation had opened investigations that were transforming corporate accountability throughout the medical device industry. Dr. Robert Kim presented our National Science Foundation research collaboration, which had expanded to include partnerships with institutions across 4 continents. The NSF funding had positioned Quantum Dynamics as the coordinating center for international neural interface safety standards, establishing our company as the global leader in patient-focused technology development. The research collaboration demonstrates how patient safety concerns can drive innovation rather than constraining it, Dr. Kim explained, presenting preliminary findings that showed improved neural interface performance when safety protocols were rigorously maintained. The Phoenix protocols are generating technological advances that would have been impossible under business-optimized approaches. Sarah Kim had traveled to Geneva to coordinate media appearances and interview schedules, her efficiency ensuring that the Phoenix story reached appropriate audiences without becoming sensationalized entertainment. Her careful management of information flow had helped maintain focus on systematic reform rather than personal drama. Dr. Morrison, she announced during a break between conference sessions, the European Commission wants to schedule consultation meetings about incorporating Phoenix protocols into EU medical device regulations. The meetings would begin next month in Brussels. The European regulatory interest represented recognition that our safety standards were becoming the international benchmark for neural interface development, extending the Phoenix influence beyond American companies to encompass global technology development practices. Linda Morrison called from Seattle with updates on Quantum Dynamics' internal transformation, which had proceeded smoothly under restored technical leadership and comprehensive governance reforms. The company had attracted several prominent researchers who wanted to work in an environment that prioritized innovation over corporate politics. Dr. Sarah Chen from MIT accepted the position as Director of Biological Integration Research, Linda reported, describing a hire that would strengthen our technical leadership while demonstrating the talent attraction benefits of proper governance. She specifically mentioned the Phoenix protocols as a factor in her decision to join the company. The personnel changes were creating a virtuous cycle where technical expertise attracted additional expertise, building institutional knowledge that would prevent future safety compromises, while advancing neural interface capabilities beyond anything possible under business-focused leadership. Marcus called with news that Phoenix patients were not only maintaining improved neural interface stability, but were experiencing continued enhancement in system responsiveness, as our research team implemented refinements based on the global safety protocols developed during the conference. The patient monitoring data is remarkable, Marcus reported, consulting real-time medical information that demonstrated ongoing improvement in neural interface compatibility. Dr. Patricia Chen at Seattle Medical describes the current Phoenix performance as exceeding theoretical projections for optimal neural interface function. The medical evidence was providing objective validation that safety-focused design principles produce superior patient outcomes while advancing technological capabilities, disproving the false dichotomy between patient protection and innovation progress that had justified Bradley's dangerous modifications. As the Geneva conference concluded, participants signed the International Neural Interface Safety Accord, establishing binding commitments to maintain technical leadership requirements and comprehensive safety assessment protocols. The agreement would prevent future Phoenix situations while encouraging innovation that prioritized patient welfare over corporate performance metrics. The document signing ceremony was attended by representatives from 43 countries, regulatory agencies, research institutions, and industry organizations, creating the most comprehensive international framework ever established for medical device governance. The Phoenix crisis had generated global cooperation that would protect patients regardless of corporate leadership decisions or investment pressures. Flying back to Seattle, I reflected on how completely the landscape had transformed since David's confident toast to innovation and teamwork just months earlier. His replacement of technical expertise with golf course networking had nearly destroyed breakthrough medical technology. But the resulting crisis had generated reforms that strengthened the entire neural interface industry. The Phoenix neural interface had not only survived its encounter with corporate incompetence, but had emerged as the foundation for international safety standards that would guide medical device development for decades. The technology I had spent years perfecting was now protecting not just its own users, but future patients who would benefit from rigorous technical leadership requirements. David and Bradley had received suspended sentences in exchange for their cooperation with ongoing investigations, but their professional reputations had been permanently damaged by criminal convictions for endangering patients through technical incompetence. They had become cautionary examples that would be studied in business schools and medical ethics courses, demonstrating the real-world consequences of prioritizing business metrics over patient safety. Pacific Venture Capital had completed its restructuring by hiring neural interface researchers as technical advisors and revising investment criteria to emphasize technical competence over fundraising ability. Patricia Williams had been transferred to consumer technology investments after her role in nearly destroying a breakthrough medical device company became public knowledge. The venture capital industry's broader transformation was accelerating, as firms recognized that technical expertise represented essential risk management rather than optional enhancement for medical device investments. The Phoenix situation had demonstrated that patient safety and financial performance were aligned objectives that required leaders who understood both business and technology. Quantum dynamics had emerged from the crisis stronger than before, with restored technical leadership, comprehensive safety protocols, and international recognition as the standard bearer for responsible neural interface development. Our research collaborations were advancing the field while maintaining rigorous patient protection standards that would prevent future safety compromises. The Phoenix protocols had become the international benchmark for neural interface safety, protecting patients while encouraging innovation that addressed real medical needs rather than artificial performance metrics. The technology I had created was now serving as the foundation for global standards that would guide the industry's development for generations. As my plane descended towards Seattle, I could see the city skyline where Quantum Dynamics occupied a building that had once housed David's celebration of corporate success, built on foundations he never understood. Tomorrow would bring new challenges as we continued developing neural interface capabilities that pushed technological boundaries while maintaining absolute commitment to patient safety. The real victory wasn't personal vindication, but systematic reform that would protect future patients from executives who might mistake business acumen for technical expertise. The Phoenix reversal had demonstrated that innovation required more than venture capital and networking. It demanded leaders who understood the profound responsibility that came with technologies that touched human consciousness itself. Marcus met me at the airport with updates on the latest research developments and patient monitoring data, his excitement evident as he described breakthrough discoveries that were emerging from our safety-focused approach to neural interface development. The Phoenix technology was advancing faster under proper technical leadership than it ever had under business-optimized management. The biological integration data is unprecedented, Marcus reported as we drove back to the company, Seattle's evening skyline glowing with lights that reflected off Elliott Bay. The safety protocols aren't constraining innovation, they're enabling discoveries that would have been impossible without deep understanding of neural digital interface principles. The vindication was complete but unsurprising. Real innovation required technical expertise that couldn't be separated from business success in companies developing life-critical technologies. The Phoenix situation had proven that patient safety and technological advancement were compatible objectives that demanded leaders who understood both domains completely. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.